Hello, I'm Faye Ballard. I'm a treating tobacco dependency practitioner here at Dorset County Hospital.
Hi, and I'm Kevin Smith, and I'm the treating tobacco dependency support worker at Dorset County Hospital. Our main job to start with is to help smokers abstain whilst they're in hospital, and the second job is to try and make them, try and persuade them to make a quit attempt, and we then refer them on to other agencies such as Live Well Dorset. Usually say something along the lines of, "Hi, my name's Kevin. We're part of the team at the hospital that does carbon monoxide testing. Do you know what that is? And is it okay to do a test from you?" Most of them will say yes, it detects smoke, or some will say no, don't. So I'll say, well, explain it to you afterwards. We do the test, and then I usually say there's 3 reasons for carbon monoxide in your lungs. 1, environmental reasons, such as your car exhaust fumes. 2, a dodgy boiler. Or the 3rd one is smoking. Are you a smoker? And then you've got to say yes.
The other way we approach it, because not everyone can hold their breath to do the test if it's inappropriate or they're on oxygen, is you just have to go in and say why you're there. I always start it with either, "Oh, I've seen in your notes," or "The ward staff are concerned and they've asked me to come and see you." Just do it so they don't feel ambushed, basically.
So once the patient's discharged from hospital, we actually call them a week afterwards, as long as we've got their consent to do so, and then 28 days afterwards. And if they're then smoke-free, then obviously we record that on our spreadsheet.
Definitely, yeah. It's I think it's the revisits, that's why they're important for the patient and us, because they're often quite shocked at how well they've done and how nicotine isn't as bad as they thought. When you talk to a lot of patients, they've probably under-medicated when they've tried previously, so putting them on the correct dose makes a huge difference, which is why we go back to check. And when they realise actually it's not that bad. And the phone calls particularly, I think, are good for us when you hear how well they're doing. You can hear how proud they are of themselves, and we're proud for them, and then it's good for us to know that it's working.
The importance is obviously the coaching, the combination of therapy with the slow reacting patch, and obviously the fast acting, either the gum, the lozenge, the inhalator, or the mouth spray. And I know Live Well use the vapes as well. So
we've noticed a big reduction in the amount of smoking we see on site since we came here about 4 or 5 months ago. A lot of the staff are backing us up, and it's a lot of the staff reporting back how much better it is. And our patient liaison have told us they're getting a lot of good feedback from visitors as well. They've noticed the difference not having to walk in through it in the main entrance.
So also talking a bit about the wards, we go to intensive care, we go to ED, we're getting referrals from staff, doctors, nurses on the wards. We've got our own smoke-free at uchft.nhs.uk email address, and we've got our own mobiles as well. So there's lots of ways people can get in touch with us and give us those referrals.
And everyone knows who we are now, so they literally do just grab us in the corridor and say, "Oh, you need to come in here." I had a patient today who heard my mantra to the patient in the next bed, and obviously just via the curtain it's not very soundproof, so I didn't even get out of the bay and she asked for help, and she isn't somebody we knew about, so that's quite a big deal for a patient to do that, so that was really good.